Hi, I'm Lisa Florence, a licensed esthetician here at Cynthia Craig, MD, Face and Body Specialist. And I'm here to talk to you about skin changes in your 40s and your 50s. So maybe you notice some changes in your skin. You might notice that your skin is a little dull, a little dry, a little dehydrated. You maybe notice that your skin's a little bit thinner, or maybe the texture is a little different than it used to be. Initially, when you come in for a consultation, we like to talk to you about what your goals are and concerns. So, one of the goals and one of the concerns that I hear about all the time are the changes during that age. And a lot of that is due to perimenopause, menopause, changes in estrogen levels, and we're going to address all of those things. We'll start off with something like skin texture, which is the surface of the skin. We have a treatment called a diamond glow, and it's a type of facial. You come in and we can completely customize that to you and your needs. We can address things like oily, clogged skin, we can address discoloration, we can address dehydration. And when we do a treatment like that, we're going to address at least two of those things with different serums. And along with that, we're going to talk to you about home care. Home care is one of the most important aspects of anything that we do in the office because we want to send you home able to maintain your skin. And a lot of times we will do both pre-treating your skin, possibly before a treatment, and then post-care and on to maintenance. So when you do a diamond glow, we're going to go over your skincare routine with you. We're going to make suggestions on how to address any of your goals or concerns. The next thing that we can talk about in terms of texture is a peel. One of the peels that we do in the office is a mid-depth peel that addresses texture, discoloration, it addresses melasma, it can also address dehydration, and overall the surface of the skin. So when you come in for a mid-depth peel, you're going to come in, we're going to put the peel on you, it's going to stay on for 4 hours, so you actually leave with it. You're going to go home, you're going to wash it off, and you're going to peel not the first day, not the second day, but you're going to start to peel around day 3. It starts in the lower face, and then it'll work its way up to around day 7 when it really wraps up. You're also going to get a home kit with that, and that's going to include some wipes that help to get the process of peeling going. You're also going to have a post-repair cream, and you're going to have a sunscreen. The next thing that we want to address as far as texture of the skin is something that is a type of laser resurfacing, like a resurface treatment, which is a non-ablative laser treatment, where you come in, you numb for a period of time. We treat the face. We can also treat other parts of the body, but we're going to talk about face today. And you're going to have some downtime. You're going to have that afternoon as downtime. You're also going to have a couple of days where you are maybe feeling a little bit swollen in the morning, a little puffy, and then every day it's going to get a little bit better until at the end of, let's say, somewhere between 3 and 7 days, you're going to have a fresh surface to your skin, brighter complexion, and we're going to help you maintain that as well with your home care. The next thing that I hear about all the time is hyperpigmentation, sun damage, and melasma. We talked a little bit about that before with a medium depth peel, but let's talk a little bit about sun damage and hyperpigmentation. One of the other treatments that we do to address that concern is IPL, and that stands for Intense Pulse Light. That addresses not only the browns but also the reds. So if you have broken capillaries, if you have rosacea, if you have some fine veins around your nose, that can all be addressed with IPL. And IPL is wonderful because it has relatively little downtime. You might be a little bit red that day, but you're going to go home, rest that afternoon, and then by the next day, it's going to be pretty much resolved. You might feel a little sunburn, you might feel a little windburn for a couple days, but that can be addressed with hydration. The benefit of that is that your skin is going to slough off those dark spots. You might notice that the areas that we treated get a little bit darker, and then they come to the surface and they flake off. And it is a beautiful treatment that gives a really nice results, like I said, with relatively little downtime. Another thing that I hear in the office all the time is fine lines and wrinkles. And there are a number of things we can do for fine lines and wrinkles. I think my favorite treatment is microneedling. And I think microneedling has a lot of misconceptions. I think people think of it in terms of like a vampire facial or things they've heard about in social media, but it's really so much more gentle than that. It's not quite, that's like the Hollywood version of microneedling, but the real version is that I think most people are very surprised how comfortable it is. In fact, I've literally had people tell me, oh my gosh, I could fall asleep, this is so relaxing, or, oh, I'm so surprised, this was a really comfortable treatment. But the wonderful thing about microneedling is it's truly collagen induction therapy. And the benefit of that is that you are thickening the skin, that the skin is able to hold more moisture, more hydration. You get a bloom of collagen and elastin, which supports the surface of the skin, so it essentially smooths out fine lines and wrinkles with multiple treatments. And I think that it is a wonderful treatment, but now we have a new advance in microneedling, and that is microneedling with PDGF. And that stands for platelet-derived growth factors. You may have heard in the past that microneedling can come with things like radio frequency, or it can come with things like PRP, which is when we take the blood, you do a blood draw, you spin it in a centrifuge, you remove the serum off the top of the blood, and you use that to essentially glide with a microneedling pen. But the interesting thing about that is that there's so much variation in how much growth factor you have in your skin. This is so interesting to me because I know that my 25-year-old daughter is going to have considerably more growth factor than I do at my age. And so the inconsistency in the product is addressed by this new PDGF, which is sterile, it is pure, and it is highly concentrated. So you can have up to 100,000 times more growth factors than product derived from your own blood. And the wonderful thing is that now that we have this as an option, it essentially switches our skin to act younger. You have faster healing, you have a better opportunity for collagen to develop in the skin. It develops more quickly. And it's a wonderful product, and I'm thrilled and excited by what I'm seeing in our practice in terms of results. So PDGF, microneedling with and without are definitely an option. We can also address fine lines and wrinkles with peels. We can revisit that, and we can also address it with Resurfix, which is the non-ablative laser that I talked about earlier. And when you come in for a treatment with Resurfix, you come in and you numb. It takes about 45 minutes to complete the face. It can also be done on different areas of the body. Some of the most popular areas of the body are the chest. And I think the thing I really want to mention about skincare in your 40s and 50s is this is the best time to do it. It is a time when you can give yourself the time and attention that you deserve. I think that what you invest in your 40s and your 50s is repaid for the rest of your life. And with some consistency and with some good guidance, you can really make a difference in how you age for the rest of your life. If you're interested in finding out more, please call our office to schedule a consultation with one of the estheticians, and we would be happy to talk to you about your concerns and your goals and put together a curated skincare program for you, and also address some of the treatments that will be appropriate for you and addressing your goals. But thank you so much for watching today. And if you have any questions, again, you can send those to skincare@cynthiagregmd.com. We're excited to hear from you, and thank you so much for watching today.